things I think are very important are making sure that you've stretched before you begin this adventure. And there are two ways you can do it for sure. If you're a two-handed person, put your thumb over the talus, bring your index finger here, and bring your foot around, being careful not to dorsiflex. My experience is going to Iowa. I do it one-handed. I put my 3 fingers on the talus. I'm pushing the talus immediately as I'm bringing the navicular and the forefoot around. And I stretch there, and I'm going to hold for my esteemed partner in crime. Oh, you know what? In my side pocket, you can put some ocean sounds.
Oh, yeah.
Or Pandora. And I make sure that they don't go too high behind the popliteal. 37. Only 2 layers of web roll.
You're waiting on this.
I have found that Google.
The style is in.
Yes. So when my fingers are holding the toes, they're holding right at the edge, and I'm constantly taking it out of the plaster. He's smoothing each time. His pull up circumferentially, the tension is the same for every roll. Keep swiping. Yeah. So he's trying to laminate it very well. I'm holding that abduction that I got before casting. The tension should be kind of just so, not too tight, not too loose. And then we go up the leg, cutting or overlapping by 50%, down the leg, overlapping by 50%, and then up one more time, overlapping by 1/3. And he's just... Okay. Now, when I do this, take all the excess, get it away. First thing I do is close the toe box, and you can close the toe box either by bringing the hand like this, or if you prefer, you can kind of go to the side. Then I take my thumb all the way back to the heel, 3 fingers here, I'm pushing that talus over, I'm bringing my wrist from extension to flexion, I'm pulling along the posterior tibial tendon. You want a flat medial border, a flat plantar surface. I also take a swipe in the front to make sure I have a nice mold. Now I'm going to mold around the calcaneus, down around below the fibula, so I can get a nice shelf. I can keep my fingers moving, and then I'm going to present the foot to make sure that you can see the 5 toes. Their toes always get a little bit more ruddy. Make sure that the cast goes below the toes. It can show more of the toes on the top, but it needs to support those toes, because toes are a lot of the clubfoot. She has very tight toes, so we have to make sure we stretch them. And I come back and I keep molding back here. And then I also would like to make sure that I don't get a bowed tibia, so I make sure that that stays nice and flat. And that looks I think that looks pretty good. All right, then when I get to the top, I'm going to push the front of the cast back so that I don't get a bowed tibia. I want to have it flexed to 95 degrees. Put the widest part of the stockinette in the back. Again, a really even, well done web roll. And then we have a little trick that we do to make sure that the cuff stays well padded. So we prepare a cuff, and then we will go ahead and back the top. I'm still working on the bottom. I'm critiquing myself, making sure I have enough of a mold to keep those toes stretched. Is the plantar surface flat? Is the medial surface flat? And sometimes I'll even kind of push in, because she has a kind of a high heel. But that looks very nice.
Yeah, it's coming around.
And then we're going to overlap where the two connect. Make sure that's nice and strong. As he gets closer to the belly, I bring the whole leg at the same bend down. And he's smoothing each time. In this particular kind of cast, I want a nice, well-molded popliteal fossa and a flat quad. Come back down. And then we do what we call a whoop-de-doo, where we fortify the front of the cast where the short leg meets the long leg. And then my job is to mold that popliteal space.
I don't think I have enough help to do it for the Hollywood roll.
Oh, man.
I know. I'm just off my game today right now.
Pressure of the video.
Pressure.
Not made for the big screen. She was. Look at her.
You win. Okay. Then he'll put a nice cuff around the top, this way that that little bit of padding that slips down, we don't leave her with a rough edge. It just gives it nice. Perfect. You can take this back to Shannon and we can do it.
You lose all your business.
Y'all should have a bus system down here. There's so many.
A carpool.
Yeah. 10 to 12.
You're right. That's a good point.
Then you go up to the kosher kitchen on the 3rd floor. Gotta tell you about
That would
that.
actually work well. Then you
He's just going down now to do what we call the Hollywood roll to get the stockinette nice, and then we're done.
That's enough. Okay.
Yes, we've done plenty.
How many of these do you do a day?
Oh, too many. So a couple of things that I do as a reminder. Popliteal fossa mold, nice flat quad.
Flat tibia.
A flat tibia, and then making sure I have a nice mold around the calcaneus. At the end, sometimes I'll just do a little squeeze to give them just a hair more room, and I check the perfusion and make sure it's good. I have them put this leg on a receiving blanket just to keep it well balanced and external. So 3 rolls of plaster typically overlap by 50%, overlap by 50%, overlap by only a third, and then up here it's usually 1 roll, and then I just what we call the Hollywood roll to make it look pretty.